Welcome back to Global with me, Tim Wilcox. Type 1 diabetes is an incurable disease that messes up your pancreas. Basically, it usually hits children. Before the discovery of insulin in 1924, every human being in history who contracted it died. Well, these days, with better insulin and care, patients often do very well. But the business of injecting with every meal is tough and difficult to manage, especially with small children. So there is real excitement at what appears to be an important step towards curing it. US scientists managed to halt the condition for 6 months thanks to insulin-producing cells. Well, we can speak to one of the senior authors of that research, Dr. Daniel Anderson. He's a professor of applied biology at Massachusetts Institute of Technology. He joins us from Cambridge, Massachusetts. Also with me in the studio, Sarah Johnson from the Juvenile Diabetes Research Foundation, which funded the US research. Thank you both. Sarah, if I can come to you first of all, because this follows on, doesn't it, from research carried out by Harvard 2 years ago. Explain what they did and how you then put that research in touch with MIT.
So Dr. Melton and his team at Harvard worked out for the first time how we could grow mature beta cells. And beta cells are the cells in your pancreas that produce insulin, a hormone that's vital for life. With type 1 diabetes, the immune system has attacked the cells, so you don't produce any insulin, you have no cells left. Dr. Melton and his team worked out how we could grow a large number of them and rapidly mature them, which makes them really useful for drug testing and as potential for encapsulation.
And you thought by wrapping these in some sort of way, this would apply directly to you. And can I just go to Daniel Anderson? How much of a challenge was it when Sarah and her team put this idea to you to develop?
Well, I mean, this is a problem people have been working on for decades. So we recognized that it was going to be challenging, but it's also very important. So we've been working on this for about 7 years now. Okay, and can you just explain then to people who don't understand, like me, very much about the science of this, how you did this and how far you are in terms of the practical trialing and research of this, albeit in animals? Sure. I mean, to us, really the fundamental challenge is how do you build a device that can deliver these cells to patients that have diabetes? Because type 1 patients, their immune system kills unprotected islets. And so if you don't protect these cells, you need to either knock out their immune system or they're just not going to work. And so we wanted to find a device and materials that we could actually put these cells into and then that would allow us to transplant them to the patients and allow for function. So essentially the goal is to make a new pancreas for the patient that does not get destroyed by their immune system.
And you've done this so far with mice?
That's right. So we've shown that we can correct mice with normal, strong immune systems for over 6 months with cells from human stem cells. And we've also shown that in primates, these devices appear to avoid rejection. In general, materials implanted into our bodies tend to form scar tissue, and these devices don't, which give us hope that they could potentially give us long-term cures in patients.
Okay, now, Sarah, so this has been done with mice, but anyone here who is related to or has type 1 diabetes will be wanting to know when it can be trialled in humans. Where are we on there?
So the next stage is there's more preclinical work that needs to be done. We need to ensure that the coating of the beta cells is safe for humans and start doing some calculations about the doses that can be implanted into humans. But absolutely, the goal is to get it into clinical trials.
Okay, and the time frame of that, and again, it's so difficult with stories like this, isn't it? That, but what sort of time period are we looking at?
It's incredibly difficult to put a time frame around it. I think we can look at a medium time frame of I don't know, potentially around about 10 years. But research takes a really long time, and it's important to note that every stage is a development.
Okay, and Daniel, the next phase for you in terms of the testing of this, what is that?
Well, you know, we're excited by the results in mice, but we want to continue to push this and build devices that we think will work in people. And one important step in that is actually doing tests in larger animals to really mimic what's going to happen in patients. And so that's what we're in the process of doing right now.
And by by testing with larger animals, what sort of period of time do you need to build in to actually be able to work out if there are any drawbacks or any potential reaction against this?
Well, we already have preliminary data that make us excited about the ability of these devices to perform for several months. But the goal is to really provide a device that could cure a patient, ideally for their lifetime, if not at least a couple of years. So, these experiments take time, but we're continually getting data that so far look good.
All right. Well, look, and just a final thought from you, Sarah. As you say, a lot of hope about this. Is this, do you think, the cure potentially?
It will certainly absolutely transform the way that people with type 1 diabetes live. It will remove the need for multiple daily insulin injections, finger prick blood glucose testing, carb counting, completely eliminate low blood glucose, which can cause unconsciousness, even death, and high blood glucose, which takes away complications. So it's a radical new life-changing treatment.
All right, well, best of luck with that. So Sarah Johnson and Dr. Daniel Anderson, thank you both very much indeed.